Cut! Cut! Cut!
How's it going, kids? This is Dr. Steve Shirley. I'm the clinic director of Spinal and Sports Care Clinic. And we're here today to give you guys some good tips on things to do you can do at home to minimize the impact of sitting at home instead of at work, and some of the things that we've seen from people doing that now that everyone's been quarantined. So we'll walk through a couple of just basic ideas for you. But the number one thing we're finding is that people are sitting longer than they normally would in an office setting. So a lot of people are, quarantined from their spouse. They're sitting at a desk or a place that's they don't usually work at. And then when they go to work, they just sit there for 2 or 3 hours without moving. So the first thing is just get off your butt and move. That's the best thing you can do. And then second, change how it is you're sitting. So we find people sitting on lounge chairs. I had one of my patients banished to the man cave because his wife didn't want to see him because she's working in the kitchen. So he's working he's got his laptop set up on his card table. And then I have a number of patients that have been working with their laptop on their lap. So it's called laptop, but it's not meant to go on your lap. So it's much better to be sitting up on something if you can. So a couple real basic things that we're seeing that's causing increase in back, neck, and shoulder pain. And one of them is just how you sit. Since most people don't have a very good ergonomic chair at home, first just look and see, are you even sitting in the best chair in the house? Because if you're not, then go find another chair and then take a look at it and say, how well is it adjusted? Was it adjusted for your kid and you're just happen to be sitting on it? So first, just take a look, what are you sitting on? And then try to modify what it is that you're sitting on. And the best way to do it is to avoid what's called flexion in your low back. And so basically you can consider that slouching. So if you're sitting and you're kind of slouching, throughout the day as you're hunched over your laptop, try sitting upright a little bit more and maybe just get a little pillow. Doesn't have to be too big, and use it as a makeshift lumbar cushion and just put it directly behind your low back where your lumbar curve is. And that'll help minimize some of the postural stress of sitting. But again, it's not just sitting. You want to get up and get out of your chair. So the best exercise for low back pain that we're recommending is both for people that are sitting in a crummy chair and they're binge watching Netflix and they're sitting on the couch for 3 or 4 hours without moving. And they're going, oh, I'm so sore in my back. And most of it's self-inflicted by not having good lumbar support. So the best exercise for that's quite simple to do. It's just called standing extension. Is you just kind of turn to the side, put your hands about belt level, and then lean back like this. And you can do multiple reps, or you can just do it and hold it. And we recommend you do that every hour or two. Getting out of your chair every hour is a great thing. Everybody's housebound right now in Spokane. So we're recommending just go outside, get some fresh air, go throw the ball for the dog, and you'll be surprised at how rejuvenated you feel. It actually, they did a few studies on that and showed that people that took more regular breaks had higher productivity. So you come back and you're like, okay, I'm ready to go take on my task and not yell at my kids. So that would be the first thing I would do. And the second thing is to take a look at where your computer is relative to your chair. Now, if you have a PC, it's a lot easier to adjust. And the main adjustment is what's the height of your screen relative to your eyes. So your eyes should hit relatively the top of the screen. So if you drew a horizontal line straight out, that should kind of hit the top part of your screen. So if it's not, just raise it up or down. It's easy to adjust. You can make a makeshift shim, just get a couple books, raise it or lower it, or elevate your chair if your chair's not adjusted right from height. The other common thing we're seeing also a lot of is people leaning off to one side because they don't have good armrests. They typically tend to lean on the side you're using a mouse with. So ergonomically, you want to take a look and say, well, where is my mouse positioned relative to me sitting in a proper position in my chair? And a lot of people are leaning forward onto their elbow and having problems with their neck and upper shoulder on the same side of their mouse. So be conscious of that when you're working, and then try to sit up a little more upright and move the mouse closer to where you're at. So the last thing I want to leave you with is a couple good exercises you can do to kind of minimize postural stress. If you've seen this before for upper back and neck pain, it'll be a review for you. But generally, any movement's going to be good, but particular movements to the area that get stressed are going to be better. So just some of the most basic exercises like shoulder rolls, doing side bending side to side to get your upper trap. You can come across and drop towards your armpit. That gets the muscles that elevate your shoulder. And then from a side position, I'll show you the most common dysfunction in terms of postural stress. It's called anterior weight bearing. I'll just demonstrate real quickly, but everybody's kind of like this nowadays, whether they're laying on the couch playing on their iPad, or they're laying on the couch watching TV, or they're working at their laptop sitting at their card table. So basically, ideally you want your shoulder back kind of square over your head back over your shoulders. And so this is kind of the posture that you start to adapt to when you're working in that position, and then your body kind of stays in that posture over a period of time, because it's like you're holding it there for 8 hours and your body thinks, hey, I must be supposed to be here. Cool, I'll stay that way. Except it puts a lot of strain on this part of your upper back and neck and at the base of your skull, which can cause headaches in addition to neck pain. So the idea in the exercise is super simple. I'm going to show it 2 different ways. It's basically everybody's doing this. So you just kind of want to go down and back with your shoulders like you're putting your shoulder blades into your back pocket. And it works better if you roll your arms back, almost like you're hitchhiking, and then bring your head back with it. So throughout the day, we tell people, try doing that while you're sitting, especially if you're on a project, you're in a meeting, I can't go anywhere. Just lean back in your chair, and it's basically the opposite of how you've been sitting. I would say it's like a fence post. If it's kind of bent this way, bend it back the other way, and then it'll feel better. So when you bring your head back too, you could kind of see I'm tucking my chin, and it's called a chin tuck. I'll show it from this direction. That component of it, it feels fantastic for the upper neck. So it's a nice way of stretching out at the base of your skull. So hopefully that's a couple good ideas for you folks. You stay safe now, and hopefully we'll be out of this soon. Stay in touch.